The topic of discussion basically underlays the autoimmune disorders specifically over here. We've gone through the multiple sclerosis, that is one of the domain in which the particular central nervous system cells are involved or they are attacked by the autoimmunity that is created against one's own body. Then we have the Huntington's chorea or the Huntington's disease in which particularly the basal ganglia are involved. The autoimmunity is developed against the basal ganglia. So that is why we see that those dilated ventricles on the MRIs that after the investigation or after that the diagnosis is made of the Huntington's disease or Huntington's chorea. The different domains that are quite frequently affected in this kind of a disease process are the cognitive functions that can be affected, the thinking process, the thought form, the thought content is affected. That basically manifests as the delusions, the hallucinations, and then we also see the behavioral effects that are seen in these individuals. There's an apathy, the moods are affected, there is a depressive state that is observed in these individuals as well. The emotional lability is seen in these individuals as well. Then we have the particularly the muscular system is also involved as well over here, ranging from the tremors. Then we have the extrapyramidal side effects, the muscular or the involuntary movements. They are observed in these individuals who are suffering from the Huntington's disease or the Huntington's chorea. So these are the range of disorders that are present in these individuals. The neuropsychiatric complications particularly, they range from the depressions, the hallucinations, the delusional phenomena that are quite commonly observed. After the diagnosis has been made, the treatment or planning the treatment is again very interesting, or it's quite easily manifested from person to person. Obviously, the clinical picture varies. So depending upon that particular clinical picture or those particular symptomatology that is emphasized in that particular individual, we are going to range our treatment modalities from the counseling, the behavioral sessions that are coupled up with the medications, of course, in these individuals. So that is the main crux of this section. We are going to focus after the diagnosis has been made of the Huntington's disease. What are the further steps? The onset of the disease will be discussed over here. The symptomatology, the clinical presentations will be discussed along with them. And then we're going to move on to the treatment modalities that are manifested in these individuals who are suffering from Huntington's disease or Huntington's chorea. So over here, the effects of disorders that are quite commonly seen are the no control over your movement. So that is the main crux over here, the extrapyramidal side effects, the involuntary movements, the twitching phenomena, the tremors that are emphasized or that are clinically presented. You have that patient at your hand who cannot even perform his daily life activities. That is going to be quite depressive for the person. The daily household chores are affected, then his daily life activities are affected. Even he cannot sometimes perform his own personal phenomena or the personal works that he has to perform. The occupation of that individual is also going to be affected after those extrapyramidal side effects. What we observe is the involuntary jerking or writhing movements that is termed as chorea. That is why Huntington's chorea is sometimes the terminology that is used for these individuals due to those extrapyramidal or those involuntary jerking, those writhing movements that are seen in these individuals. What happens over here is the muscle problems such as rigidity or muscle contractures due to those spasticity that is observed in the muscles of these individuals. There is a dystonia in the muscular system of these individuals. Then we also observe the slow or the abnormal eye movements that are observed also. Then we also observe the destruction of the cells in the basal ganglia. So that is the mainstay over here. The basal ganglia are affected. Obviously, the central nervous system is involved, but the attacking cells are basically focusing on the basal ganglia, and that is why the ventricles are dilated in the individuals. When we compare them to the controlled trials of the MRIs, the ventricles are in a dilated state in these individuals who are suffering from this kind of a disease process. The life expectancy changes between how bad the symptoms are, and it basically depends upon the severity of the symptoms in these individuals and how it is affecting the lifestyle of that individual. They live from 10 to 30 years after the diagnosis is made. The limited mobility is the mainstay over here, the loss in the ability to speak clearly. So as the disease progresses in these individuals, they are not going to be comprehended properly by the people surrounding them. So the the clarity of the speaking is also going to be affected in these individuals. The treatment modality basically depends upon the physical therapy and the talk therapy. So that is the mainstay of the treatments that we are going to focus on. The physical therapist restores the muscle strength and the function through the exercise. So the physical therapy is the mainstay over here. We're going to restore the muscular functioning of that individual through the exercising activities. Over here. Then the neurologist basically treats the nervous system disorders. So it's basically a multifactorial approach towards the disease over here. We're going to have a physical therapist, we're going to have a neurologist, we are going to have a psychiatrist for that talk therapy or for those counseling sessions to take that person out of those delusional, hallucinational, or those depressive episodes or the affective episodes, mood disorders if they're suffering from, treats the mental disorders primarily with the medications. So usually the talk therapy can be observed, but usually the medications are also coupled along with these cognitive behavioral therapies in these individuals. And then we have the primary care providers that are also playing their role. We have to counsel the primary caregivers as well, if they are the parents or if they are the any of the close relatives or any of the family the friend circle that is involved, that can be involved in the primary care provider activities. They prevent the diagnosis, and the diagnosis is again also going to be explained to them. The preventive techniques are going to be explained to them, and then the treatment of this disease process is also going to be explained to them, and awareness has to be created among the primary care providers regarding the disease process that the person is going through. The medical generalists are also going to be involved over here, the diagnosis and the management. They're going to basically lay down the management of such hereditary disorders in these individuals as well. The current research is the Baltimore Huntington's disease causes the brain disorders, the uncontrolled movements. The people also suffer from the emotional problems and the loss of the thinking ability after this. So this is the picture basically that is focusing on the basal ganglia that we were focusing on. Any of these basal ganglia can be involved in this attack process. It can be the caudate nucleus, it can be the globus pallidus and putamen, subthalamic nucleus and substantia nigra. These are the basal ganglia that are present over here, and that can be affected in the disease process. That is basically there is an autoimmunity that is created against these basal ganglia when the person is suffering from Huntington's disease or Huntington's chorea. So in this section, basically, we discussed the different treatment modalities that are present for the different neuropsychiatric complications that occur after the person has been diagnosed with Huntington's disease or chorea. So that is the end of this section. Thank you for watching sqadia.com.